Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us once again.
Thanks for having us.
Great. I've got two guests with me today, Schiavone of Holy Name Medical Center, and Deyka Torres. Deyka is a cervical cancer survivor, and together they're going to talk today to bring awareness during Cancer Screen Week. It's December the 6th, as we've got just one more day of Cancer Screen Week, although cancer screening is early week. Isn't that right, Dr. Schiavone?
That is true. According to the American Cancer Society, the early detection of certain types of cancers can lead to easier treatment and cures for a number of different.
Now, Doctor, what exactly is your specialty? Give us just a bit of background about yourself. Do you deal with all types of cancer or specific?
So I'm a gynecologist. I specialize in the surgical and medical treatment of all types of female cancers.
Okay. And Deyka, you're a cancer survivor, cervical cancer. When were you diagnosed?
Diagnosed last year in August.
So you've been on this journey for just a short period of time, and you're doing quite well, I understand.
Yes, thank God for.
Now, as I mentioned, we are in Cancer Screen Week. You mentioned the importance of getting screened early, Doctor. Talk about some of the challenges associated with getting the word out about early screening.
I think some of the challenges, particularly in patients who are feeling well, not realizing the imperative need to continue for routine screening with their doctor, because potentially they don't have symptoms or they recognize the importance or the benefit of routine screening. But we know that many types of common and very deadly cancers, such as colorectal cancer, breast cancer, lung cancer, as well as cervical cancers, really benefit significantly being detected in early stages where they're much more highly treatable and curable at that point.
Now, Deyka, had you ever been screened for cancer prior to your diagnosis?
Yes, actually, I was going every year and having years done, and would come back normal. And actually, I didn't really show any symptoms until anything that was too out of the ordinary. Last April.
Mm-hmm. Last April. What were some of those symptoms?
I had spotting in between periods, and it was very sporadic. And then I also had pelvic pains every once in a while. They were, not detectable if I wasn't really paying attention to my body.
Doctor, what are some of the recommended tests? I mean, there's not one size fits all, obviously.
Sure. So obviously colonoscopy for colorectal screening, for breast screening, as well as pap smears and HPV testing for cervical cancer are just some of the screening tests that may be appropriate for you. But again, it's very important, obviously, to see your own doctor because all tests can be, for each different person, it's different screening being your age, your sex, your gender, as well as other risk factors. So that's why it's very important to talk to your doctor about what's the appropriate testing.
And as far as frequency of testing, should you start being tested, say, in your early adult life? What is a good time, and how frequently should you be tested?
So that's a great question. So again, it's very different depending on each individual person and their own personal, as well as the type of cancers that are. So that's why, the most imperative thing is to be seeing your doctor yearly, so that way they can do assessments of what your risk factors are and what the appropriate screening tests for you and what interval is appropriate, as well as at what point to start.
Now, Deyka, you were just going on about your business, living life. You had plans and all types of things. How did the diagnosis impact your life initially? And once the smoke cleared, how were you able to put together a successful treatment team and plan?
Well, I got to say it was a little scary at first. When you receive like that, the first thing that runs through your mind is, am I going to die? And actually that was my first question to my doctor. But, he said, that I would be fine and that the cancer that I had was treatable. So I made my appointment right away with Dr. Schiavone, and indeed we came up with a plan. The best treatment for me was to actually have a hysterectomy and go through chemo and radiation. So once I went through all of that, it was a little bit, but once I went through all of that, I was back to normal.
Advice would you have for other before they have symptoms, and maybe if they're experiencing some of the things that you did?
To definitely go get those screenings every year. Don't miss them. It's a way of keeping track of what's happening in your body, and to listen to your body, because sometimes the symptoms are very mild. They can be easy to miss. So definitely go and have those screenings and talk to your doctors about your history, and just kind of stay on top of your medical appointments.
Dr. Schiavone, have you noticed maybe a reluctance for some women to talk about some of the problems that they may be having, maybe out of fear, or as you say, feeling okay, maybe a little problem here, but nothing that they think they need to worry about? Is there something that you do as a healthcare provider to kind of loosen them up, get the conversation started to talk about the importance of early screenings?
Yeah, I think it's important that women feel comfortable with their providers, that they know that no topic is off limits, to fully report how they're feeling, because certainly some symptoms which they may feel are, unimportant or just regular, experiences that are normal, may be something that your provider may pick up as something that could be a sign of, something more insidious or more concerning. So I think definitely having an open and honest relationship with your physician or your medical practitioner, and seeing them on a regular basis so these type of things don't get missed.
Where can we go online and learn some more?
There's a ton of information and resources on the website, cancerscreenweek.org. So please feel free to check it out so you can learn more and potentially reduce your chances of having a cancer in the future.
Dr. Schiavone, thank you so much. Deyka Torres, thank you as well. It's been a pleasure talking with both of you this morning.
Thank you so much.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.